Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. If you follow our channel, you know I'm a cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here, and I don't do boobs, bellies, or butts. We're going to talk a little bit about some important stuff with recovery today, and it's not the most romantic topic, okay, but we're going to talk about constipation. And this is a real situation that is problematic after any type of surgery, but cosmetic surgery for sure. And so, I do over 100 facelifts a year, and our job as a provider is to make sure that we can set up the patient's recovery to be as safe and effective as possible. All right? So, everybody that's watching this has been constipated at one time or another, and it's no fun. And but when you've had surgery and you have stitches and swelling and bleeding and you're recovering, then it's a lot less fun. And constipation could be problematic because when people strain on the toilet, they do what's called a valsalva. They bear down, and that increases your blood pressure. It's well documented that that can cause bleeding, which can lead to hematoma. And with eyelid surgery or facelift surgery, that can be very serious situation. Also, people can become so impacted that they have to digitally disimpact themselves or have somebody else do it. So of all the situations that occur in recovery, that's one thing you don't want to occur. So what can you do? First of all, with any recovery, you have to be proactive and you have to plan. I'll tell you what I have my patients do. And I'm not giving medical advice, so if you have situations, you talk to your own medical provider. But what I have my patients do, number one, is we talk about this. It's a real thing. And so what can cause constipation? Well, dehydration, immobility, and the big bad guy in all of this are narcotics. Okay, so if you're taking Percocet or Lortab or hydrocodone or any of these narcotics, they really slow down peristalsis and the digestive system, and then people aren't eating very much. So it is kind of the perfect storm for constipation. So number one, I want people to be aware of this. I want them to hydrate. That's very important. What I have my patients do is to get 3 over-the-counter medications that really work well. Number one is any type of over-the-counter stool softener. Colace is one brand, and I have them take 2 of those twice a day, starting several days before the surgery. I also want them to be on a fiber supplement. You can use Citracel or Metamucil. Citracel is nice because it does not cause a lot of gas, where Metamucil can. And I also want them to use a general over-the-counter laxative once a day, which is Miralax is a very good one to use. So you have the laxative, you have the fiber, which is also a laxative, and you have a stool softener. But you need to start this before you start taking narcotics because, again, it can be extremely uncomfortable and it can affect your result. So if you already have problems with bowel movements, this may be something you want to talk to your physician about. And otherwise, I hope this is helpful. And again, it's not a very fun subject, but our job is to make sure that our patients have a safe and effective recovery, and having normal bowel movements is just part of the situation. I'm Dr. Joe Niamtu, LoveThatFace.com.